The World Health Day is a global health awareness day celebrated every year on April 7, under the sponsorship of the World Health Organization, WHO, as well as other related organizations. In 1948, the WHO held the first World Health Assembly. The Assembly decided to celebrate April 7 of each year, with effect from 1950, as the World Health Day. The World Health Day is held to mark WHO's founding, and is seen as an opportunity by the organization to draw worldwide attention to a subject of major importance to global health each year. The WHO organizes international, regional, and local events on the day related to a particular theme. World Health Day is acknowledged by various governments and non-governmental organizations with interests in public health issues, who also organize activities and highlight their support in media reports, such as the Global Health Council. World Health Day is one of 8 official global health campaigns marked by WHO, along with World Tuberculosis Day, World Immunization Week, World Malaria Day, World No Tobacco Day, World AIDS Day, World Blood Donor Day, and World Hepatitis Day. Recent year's themes: 2016, Halt the Rise, Beat Diabetes. 2017, Depression, Let's Talk. 2018, Universal Health Coverage. 2017, Depression, Let's Talk. And 1892 lithograph of a woman diagnosed with depression. World Health Day 2017, celebrated on April 7, aims to mobilize action on depression. This condition affects people of all ages, from all walks of life, in all countries. It impacts on people's ability to carry out everyday tasks, with consequences for families, friends, and even communities, workplaces, and healthcare systems. At worst, depression can lead to self-inflicted injury and suicide. A better understanding of depression, which can be prevented and treated, will help reduce the stigma associated with the illness, and lead to more people seeking help.